Hello students and welcome back to my channel. This is the Community Nutrition series of videos, and today we're going to continue by taking a look at the Community Nutrition programs. So expect to learn in this video the planning and design of the Community Nutrition programs as well as the evaluation of them. Hi, I'm Tommy. I'm a human nutrition student and researcher at the university. What I do in this type of videos is to synthesize my classes so then I can explain and teach you the best and most valuable information you need to know. So let's begin this video by taking a look at the planning and design of the community nutrition programs. So the concept of health is perceptual, functional, and adaptive. The factors influencing health are biological, environment, lifestyle, and the healthcare system. That's why we need health programs. And these include the health policies, the healthy environments, and an increase in the personal skills of the individual, so to empower the people. Examples would be the World Health Organization healthy eating, physical activity and education awareness raising, cross-sectoral collaboration, monitoring and evaluation. For example, the Sustainable Development Goals. What are the stages in program planning? Well, we have to identify the problems, then set the priorities, the purpose, then the activities, the resources we need, we have to act, and then evaluate. So let's study the needs first. Health need is equal to the current health status divided by the desired health status. Here we have to do the strengths, weaknesses, opportunities and threats analysis and the sustainability analysis as well. So no external economic dependence and sustainability of environmental policies we are going to implement. The indicators are the direct or indirect database measures such as the social demographics, the health, the service and the resource utilization. So how do we reach consensus here? Well, we have the consensus building methods, such as the snowball technique. This is a questionnaire asking most important problem of the area to 15 people. And we have to analyze the past, present, and future here. And each one of these 15 people tries to find a possible solution. Then we have the Delphi technique. This is a meeting with people with extensive knowledge on the topic, and it lasts for 45 to 90 days. Here we try to reach a consensus using questionnaire of needs, idea ordering, and reassessment. Then we have a focus group. Here there is a moderator and 15 to 17 like-minded people. Here there are no conflicts, and this should last less than 90 minutes. In this method there is no individualism, we have to favor the participation of everyone, and this has recorded sessions, together with a short questionnaire at the end. Then we have the nominal group method. This tries to order problems by importance. Here we have to ask questions that will lead to a reflection, and we have to record the ideas for 15 minutes. Then there is the presentation of the ideas from 30 to 60 minutes, and afterwards a discussion in which we provide solutions, and then we have to choose one by voting. And then we have to set priorities. So which one of these problems is the most damaging? Which one is the most feasible? Then also there is the cost of the program to solve the problem. The feasibility of the project. Will I be rejected if I propose it? And then after the priorities we have the objectives. These are expressed in terms of improving the target population. The goals are overall objective or ultimate goal, the intermediate objectives, which assess the risk factors, and the specific objective. So we're going to do this by such and such. There is a hierarchical order so that the achievement of one helps the other. If we complete specific objectives, we're going to complete part of the intermediate, which are going to complete part of the ultimate goal, the main objective. And then we have intervention design. So this is a report with recommendations. Vulnerable groups, those with special needs, and those with chronic diseases, such as risk factors. Here we have to assess the effectiveness and feasibility based on the population we are trying to target. The actions impacting the population diet are the food availability mainly, then the health impact of the food, and the public knowledge and interest. All of these things are going to directly impact their health. Then we have, of course, to base our community nutrition programs on the current diet health knowledge available, and also to include interactive activities. And here we have some examples. The World Health Organization step-by-step framework, first immediately feasible activities, then medium-term feasible activities, and finally those that need higher resources. The MPAS, which is to identify policy interventions to improve the food environment, by identifying the key problems and searching for possible solutions. Then we have the ANGELO, which stands for the analysis grid for elements linked to obesity, analyzing the elements associated with obesity, for sure, to guide community actions for its prevention, considering the importance and viability of the options. Again, is it feasible? And the activities? Some examples will be informative and educational, nutritional fortification, food supplementation, nutritional supplementation as well, modification of the composition of certain foods, the risk factor screening activities, and environmental changes. In terms of mobilizing resources, so what do we need? Human resources for sure, so we have to say the number and the professional category. An example of this would be we need 20 nutritionists for this program. Financial resources, so the budget and the payment systems we are going to use. The material resources, such as equipment, educational resources, and premises. And the administrative resources as well. So we need to establish hierarchical levels and choose a person in charge of the management. And then we have the evaluation, which we're going to see in more detail in a few moments, but these are the main points. So the diagnosis of the initial situation, the evaluation of the process, so continuous monitoring of each phase, the evaluation of the impact, so here we know which phase had more impact, and the final result evaluation, so the achievements and long-term repercussions. It's important to share the experiences we had as well as the achievements we got, so others can benefit from those, and they can use it as a starting point for maybe another program. Moving on, we have the evaluation of community nutrition programs. This is using scientific methods to assess and improve the program. Here we have to find information for the improvement changes. We have to obtain knowledge about the effectiveness. And here we have to define some terms. Efficacy is the likelihood of benefiting. These are the objectives divided by their results in an ideal circumstance. Effectiveness is the achievement of proposed objectives. This is the objectives divided by the results in a real circumstance. And then efficiency. This is the achievement compared to others. So resources divided by results in a real circumstance. And these three are all evaluated using financial cost, which is the analysis of the relationship between cost and effectiveness. And it's based on the achieved benefit. So what is the need for evaluation? Why do we need to evaluate these projects? Well, to introduce modifications and understand the impact we have achieved so far. To assess the extent to which the objective has been achieved. So the priority order, which one of the phases is the most important or had more impact. Number 3, to inform the population. Number 4, to identify elements that have not yielded satisfactory results and maybe change them for others. Number 5, to raise awareness among politicians to continue investing, which is very important. Number 6, to assess whether the resources used have been distributed correctly. Maybe we need to put more effort in other areas. To check the functioning of innovative strategies in terms of solutions. To gather information for nutritional policies as well, so to create new guidelines, for example. To get the data for planning future projects and to benefit others, and the utility for other professionals as well. This data, again, can be very useful for other people to start a new project and maybe find something new. The evaluation dimensions. We have the initial evaluation, which is the diagnosis of the starting situation, so before implementing the program. Here we have to formulate objectives, general approach, and design the intervention. Then there is the process evaluation, which is the formative exploration, the ongoing project monitoring, detect failures, ineffective methods, and the inconvenience. This is using indirect markers, and it helps find solutions tailored to each situation, which is very interesting. Then we have the impact evaluation. These are the dietary modifications due to the intervention, so how did population change their diet. It analyzes changes in attitude and skill development, important. It measures the objectives reflecting the determinants to be modified. It is divided into 3 stages, so we have the immediate evaluation, which is the effectiveness of the message and level of understanding right after finishing it. The primary evaluation, which is the immediate changes in dietary behavior, and the deferred evaluation, which assesses the persistence of changes in dietary behavior, so in the long term. And the evaluated items here are the changes in dietary practices, the access to nutritious food, the improved nutrition knowledge, which is important again, to empower the people, the changes in consumption habits, if they improved or not, and the sustainability of nutritional practices. And then last, we have the results evaluation, so the achievements obtained compared to the starting point. This is the health status evaluation, mortality and morbidity, improved quality of life through nutritional status biomarkers. And here we can find changes in nutritional status or improvement in maternal and child health. Changes in nutritional status is done by using the prevalence of malnutrition, overweight, and obesity, so before and after, comparing them. And the improvement in maternal and child health is the reduction in rates of premature births. low birth weight, and infant mortality. And then we have the evaluation techniques. So here we have to take into account the need to evaluate the projects, so the ones we said before, and the self-evaluation is required here. We have to consider the quantitative and qualitative aspects in a complementary manner. So the quantitative evaluation is using objective methods, statistical considerations, and numerical expressions. We have to use the dietary surveys and nutritional status assessment. There is an evaluation of child growth, laboratory tests, such as blood analysis, food intake records, and so on. On the qualitative, though, is much more difficult. It seeks to describe the how and why of the observed changes, and it uses indirect observation, so non-verbal behaviors in closed groups. The ethnographic method, using observation of participants and educational process. The in-depth interview, which can be informal, semi-structured, or open standardized interview. The focus group and discussion group, so here we have a coordinator, 6 to 12 participants, and a group interview or conversation. It depends on how the coordinator wants to do it. And then we have the conclusive response. So it's to verbalize thoughts based on reading a message. And here we have the individual and group level message analysis. And then we have the effectiveness and efficiency. So you have to know that the innovations have a higher acceptance if they are simple, consistent, and they have short-term benefits. The efficacy is the achievement of the objectives, and the efficiency is how they were achieved compared to other methods. And they are usually quantified in economic terms. And here we have the cost analysis, the cost effectiveness analysis, and the cost benefit analysis. And last but not least, we have the valorization. Here, we disseminate and share the results to provide added value to others. It can be directed at different groups, such as the participants of the intervention, the key individuals involved, the professionals, the funders, or even the politicians. And here we use different materials and methods based on the group we are targeting. So the newsletters and brochures, the complete technical report, publications, seminars, and even the press releases. And this is all done to benefit people and let them use this data for future projects. Okay, this is it for this video. I hope you understood everything I said. If you didn't, there is a comment section down below. Don't forget to like, subscribe, and turn on the notifications so you get notified every time I upload a new video. If you find value in this, please share it to your friends and family to spread this knowledge to them as well. Thank you so much for watching, and I will see you in the next one, in which we're going to talk about the practical applications of the community nutrition. So stay tuned for more information on community nutrition. I will see you there. Hope you enjoyed. Ciao!